So we're talking about regenerative medicine, and with regenerative medicine, we're using lots of things that are conventional. And conventional things would be like
platelet-rich plasma and growth factors.
and some of the things that we're using are kind of proprietary stuff that are used in other areas that we're just now introducing into hair transplantation. And our early results have really been exciting. My area of expertise is in facial plastic surgery.
Mine is in regenerative medicine.
So by combining these two talents together, we're finding that we're getting not 1 + 1 = 2, but 1 + 1 = 3 and 4. And we're getting not just the improvement in the take of our hair grafts, but we're also getting more hair follicle growth, more density, more caliber and thickness.